AED. Having trained first responders with an AED is the most effective treatment for SCA and greatly increase the person's chances of survival. AEDs, automated external defibrillators, are computerized portable devices that can help prevent death due to sudden cardiac arrest. In an emergency, the AED directs the rescuer and offers step-by-step voice instructions through the defibrillation process. Stay calm and follow the directions given by the AED. AEDs are easy to use and require minimal training. There are several different brands of AEDs, but they all have 4 basic steps. 1. Turn on the AED and listen to the voice prompts. 2. Attach the AED pads to the victim's bare chest. 3. The AED will analyze the heart rhythm automatically. 4. Deliver a shock if directed to by the AED. AEDs also have common voice prompts, and some phrases you'll hear are analyzing rhythm, charging, stand clear, do not touch the victim, press the shock button, shock delivered. When the second rescuer arrives, have them place the AED by the victim's head, turn on the AED and follow the voice prompts, which will coach the rescuer through specific steps needed to use the AED. Remove the defibrillation pads from their packaging. Look at the pictures on the pads to see exactly how to place them. Confirm the AED pads are attached to a cable and plugged into the AED machine. Combining CPR with an AED is most effective if the AED is used as soon as possible and if interruptions to chest compressions are minimized while applying the pads and before and after each shock. Remove the self-adhesive backing and attach the electrodes firmly to the victim's bare chest. Typically, one pad is placed on the victim's right upper chest wall and the other on the victim's left chest side below the nipple. The AED will begin to analyze the victim's heart rhythm. Ensure that nobody, including yourself, is touching the victim while the AED is analyzing. If an AED indicates that a shock is required, the AED would automatically charge and advise you to push the shock button. Some models state that it is going to shock. Make sure that no one is touching the victim. Call out, "Clear." Listen for the voice prompts from the AED. If it states, "Start CPR," begin immediately with chest compressions. Continue to listen to the voice prompts from the AED. Every few minutes, you will be prompted to stop CPR so the AED can reanalyze the victim's heart rhythm. Do not remove the pads. Perform CPR with the pads in place. Do not turn off the AED. There may be error prompts from the AED. The most important thing is to stay calm and know that the AED will coach you through the problem. Some common prompts include check pad connection. If this is indicated, make sure the pads are placed correctly. If the AED continues to indicate a pad problem, remove the pads and check for water on the chest or excess hair. Dry the chest and shave excess hair. Apply a new set of pads if the prompt continues. If motion detected is indicated, make sure the CPR has been stopped and that the cables are still. If low battery is indicated, the battery is low and needs to be replaced. If no shock is indicated, continue with CPR. Certain circumstances require caution. Before using an AED, make sure the area is safe. Water can be a conductor for electricity. Before performing the defibrillation, make sure the victim is not in contact with water. Nitroglycerin patches on the chest or any other patches must be removed from the victim's chest before using the AED. If you see an implanted defibrillator, place the edge of the pads at least 1 inch away from any implanted device.